Welcome to our webinar. It's called Creative Strategies to Expand Treatment Capacity, Lessons from Bexar County. I'd like to go ahead and thank our sponsors. And by the way, I should introduce myself. I'm Greg Hanch. I'm the Executive Director of NAMI Texas. NAMI Texas is the Texas affiliate of the National Alliance on Mental Illness, and we are part of America's largest grassroots mental health network. We exist to improve the quality of life for people affected by mental illness, and we do so through education, support, and advocacy. We have 27 local NAMI affiliates throughout the state, including NAMI San Antonio, and we have close to 2,000 members made up primarily of individuals with mental health conditions and their family members. Part of our work focuses on the criminal legal system, and we've learned of some promising practices in Bexar County that we wanted to share statewide. And with that, I want to thank our webinar sponsors. And this is one of a number of webinars that NAMI Texas is doing throughout the fall and the beginning of the winter. We started our webinar series last week. We'll be continuing with additional webinars nearly every week for the rest of the year. Our webinars are sponsored by the Hogg Foundation for Mental Health, Pharma, Neurocrine Biosciences, AbbVie, Methodist Healthcare Ministries of South Texas, and Otsuka. Thank you to all of our sponsors for making this possible. I mentioned our upcoming webinars. We have one on Wednesday of next week, Wednesday evening, focusing on improving mental health through patient empowerment and technology. And we also have a webinar the following week on October 29th on how individuals with mental health conditions can advocate for themselves within the college academic environment and the workplace. More details about our webinars are available at namitexas.org/webinars. So please visit that website to register today. I also just want to mention, you can see on the screen here that we're having a big event on November 7th. What's depicted on the screen here is just part of that event. We have our annual presentation of awards starting at 10 a.m. Central Time. I'll just point to a couple awards of note here among the others. We're giving our Advocate for Justice Award to the Chief Justice of the Texas Supreme Court, Nathan Hecht, and the presiding judge of the Texas Court of Criminal Appeals, Sharon Keller. We're also giving our Enduring Volunteer Award to Ms. Carmen Ortiz, who is a longtime volunteer of NAMI San Antonio. So we hope that you'll join us to see these individuals receive these very well-deserved awards. We'll also be having our annual business meeting after this event, but before actually the annual business meeting, shortly before 11 a.m. on November 7th, we'll be hearing from Kenneth Wilson, who is the CEO of Haven for Hope in San Antonio. So you can see we're putting a real spotlight on Bexar County, and we hope that you'll join us. And also on this day, NAMI Texas will be giving a public policy update, sharing with our community what our policy priorities are for the upcoming legislative session. Just I want to give a few instructions here about how you can engage in the webinar. Please enter your questions in the Zoom Q&A box. Panelists will address questions at the end. We'll be monitoring the questions as they come in. If you need any assistance, you can raise your hand. I believe someone's already done that. You can also email me at executive.director@namitexas.org if you need any assistance. This webinar is being recorded. It will be available by Zoom link after the webinar is complete, and it will soon be streaming on Facebook Live. We don't have that up quite yet, but it'll be up on Facebook Live soon. Please also look at the feedback survey that will pop up on your screen following the conclusion of the webinar. We would appreciate your feedback. We'd love to hear from you on your thoughts of how the webinar went. And lastly, you will be learning about innovative strategies in Bexar County. So we just encourage you to think about how you might be able to apply the lessons learned today to programs in your community or to public policies that you're involved with. So just think about the applicability of what we'll be covering in the webinar to the work that you do. I'll go ahead and introduce our panelists, and then I will turn it over to them. First, we'll be hearing from Commissioner Justin Rodriguez. Commissioner Rodriguez began his career in public service as a juvenile prosecutor for the Bexar County District Attorney's Office, where he worked diligently to assist young offenders in their rehabilitative efforts. Elected to the Board of Trustees of the San Antonio Independent School District in 2004, Commissioner Rodriguez served in that role for 3 years before being elected to the San Antonio City Council and representing District 7 for 2 terms from 2007 to 2011, improving the quality of life for residents by enhancing educational outcomes and creating economic opportunities for hardworking families has always been his focus. In 2012, Commissioner Rodriguez was elected to the Texas House of Representatives. He served 3 full terms as state representative for House District 125, and he was reelected for a 4th term in 2018. During his time in the legislature, Commissioner Rodriguez advocated for increased access to and affordability of higher education, voting rights, and accessible and affordable health care for all Texans. A strong advocate for San Antonio and Bexar County on the House Appropriations Committee, he sought and secured several leadership roles during his tenure, including Deputy Whip for the House Democratic Caucus, and he was part of the leadership team of the Mexican American Legislative Caucus. On January 4th of last year, Commissioner Rodriguez was appointed to serve as Bexar County Commissioner for Precinct 2, and he is filling the first 2 years of the unexpired term of longtime Commissioner Paul Elizondo. We're looking forward to hearing from Commissioner Rodriguez. Another panelist we have with us is Mr. Gilbert Gonzalez, who has more than 30 years of experience in the field of substance abuse and mental health, crisis prevention, and in treatment provision as a clinician, university faculty, project program director, and policy advisor. He has been responsible for development of program and implementation for community-wide jail diversion services. Mr. Gonzalez is the first deputy director for Bexar County's new mental health department. Mr. Gonzalez has served as a member of the Federal Substance Abuse and Mental Health Services Administration, SAMHSA, National Leadership Forum for Behavioral Health, and Criminal Justice Services, the National Stepping Up Initiative, the White House Data Justice Initiative, and he is currently a member of the Board of Directors for the National Association of Counties, as well as serving as the Vice President of the National Association of Community Behavioral Health Disabilities Directors. And thirdly, we have Mr. Mike Lozito, who has served he has over 30 years of criminal justice experience as a pretrial technician, youth services officer, parole supervisor, section director, and regional director. A large portion of Mr. Lozito's career was with the Texas Department of Criminal Justice. He was acknowledged by the Texas Corrections Association as the Outstanding Adult Corrections Administrator for 2008. He began his career with Bexar County in June 2010 as the Judicial Services Support Manager responsible for the Pretrial Services Office and Indigent Defense Attorney appointments. Mr. Lozito has been the Director of Judicial Services for Bexar County since 2011. He is responsible for administrating the activities of the Justice Intake and Assessment Center, Pretrial Services Office, Mental Health Department, Jail Population Impact Control Unit, Medical Examiner's Office, Crime Investigation Laboratory, Court Collections, Problem-Solving Court Programs, and the Dispute Resolution Center. We're thrilled that our 3 panelists are here with us today. And I'd like to turn it over to Commissioner Rodriguez for him to provide his comments. Thank you, Commissioner Rodriguez.
Great. Thank you, Greg. And thank you and welcome to everybody for allowing us to spend a few minutes here with you at the National Alliance on Mental Illness, annual conference. You know, I have kind of the easy job, and that's just to set the table, so to speak, for Gilbert and Mike, who I've worked with over the last 2 years on helping address mental health issues here in Bexar County and San Antonio. We all know that we are living through unimaginable times at the moment. We're facing serious health, physical health and mental health, as well as economic crisis during these times. Mental health in particular is a major focal point for us today, and is especially true when we consider the theme of this conference, right? And that is Texas Toward Tomorrow. Let me highlight a couple of things that the Center for Disease Control, the CDC, recently reported. These are facts that we know. First of all, the research shows that Americans' mental health has suffered significantly during the COVID-19 shutdowns, and vulnerable Americans have been disproportionately impacted. We also know that symptoms from this report of anxiety and depression increased significantly since the prolonged stay-at-home orders earlier this spring and summer, with, again, disproportionate worse mental health outcomes among vulnerable groups. We also know that 41% of Americans reported at least one adverse mental health condition, and 11% reported seriously considering suicide, 11%. 53% of American adults reported that their mental health was negatively affected due to worries over COVID-19. That's over half of us. 1 in 5 of those who sheltered in place reported experiencing a major negative mental health consequence as a result. And then lastly, the overall negative impact of social distancing practices and economic shutdowns on mental well-being has led to reports of increased substance abuse and overdoses, decreased access to addiction treatment services, and increased calls to suicide prevention centers. So that provides a little bit of the framework of the circumstances that we're dealing with. Let me just highlight a couple of things, even pre-pandemic, that the county here in Bexar County we're working on to address mental health issues, and I think in a way is set us up in a way that we're able to be nimble in our response. Certainly not perfect, but prepared for some of these potential outcomes. And I know Gilbert and Mike will talk more specifically about these a little bit later. Last year, when I got on the court, it was my first year. We met with the University Health System here in Bexar County. That is historically known as the Bexar County Hospital District. It now goes by the name University Health System, but essentially falls under the umbrella of the county. We met with them and were able to partner with them and get about $7 million, $7.1 million to be exact, on an annual basis to augment what the county was already working on with respect to mental health. And that $7 million has been deployed in a number of different buckets, so to speak. Namely, one category being homeless services. We know our homeless have significant issues related to mental health. So about $1.4 million of that was addressed to deploy to the homeless in our community. Secondly, to crisis services. Thirdly, to services for victims of domestic violence. We've got a little over $1 million of that 7 deployed to address those issues. We also know too, not just anecdotally, but from the data, there's been an uptick in domestic violence calls and outreach to our community during the pandemic. And then lastly, the bulk of the money, about $3.3 million to pre-crisis services, right? The idea is to get to individuals before something tragic happens or someone gets hurt. So again, Mike and Gilbert will talk a little bit more about that, but I wanted to highlight the fact that Bexar County continues to focus on bringing those resources together for greater access to provide the best treatment and support possible in our community. We're hoping to share our story today. These guys are very capable. I've come to work very closely with Mike and Gilbert, so I'm leaving you in very capable hands. So with that, let me go ahead and introduce Mike Lozito, who is the Bexar County Director of Criminal Justice Policy and Planning here at Bexar County, and Gilbert Gonzalez, who's the Director of the Mental Health Department. They'll talk a little more specifically about what I just highlighted, including identifying any gaps, leveraging additional resources, and showing just how these dollars are going locally to make a difference in the mental health community. So I'll turn that over to you, Mike and Gilbert.
Good afternoon, everybody. This is Gilbert Gonzalez. I'm going to start off by sort of giving you an introduction and a background. Thank you, Commissioner Rodriguez, for all of your help, and certainly for the leadership of Commissioner's Court. We're going to run through quite a bit of information, but overall, we'll share our strategies. And the strategy is really a plan or series of plans and approach to how we gain or achieve a certain aim. And that aim is nothing more than expanding treatment capacity, increasing resources, and bringing the community together. You'll hear us talk about a number of initiatives, but behind each initiative is a sort of a gathering of organizations that have done a lot of work behind that. So let's go right into it, and let's talk about the first slide. Some of you may have seen this slide before, but it really depicts the difference between the two monoliths of the mental health system, which we now call behavioral health system meaning mental health and substance abuse, and criminal justice. Before the Office of Behavioral Health was created, we kind of just, mental health was one thing and criminal justice in the other. And since then, we've combined the initiative to look at both these huge systems of care and to bring in the community. Next slide. The next slide, please. So we're going to talk about how we've identified some of the treatment gaps very specifically, and some of the approaches that we take towards improving continuity of care specifically. And you'll see that as we describe some of the services and how particular organizations leveraged their services with another component in the system of care to truly address the needs. And then finally bringing together the whole system. And at the end of this presentation, you'll see what we're talking about. Next slide, please. So let's talk about the approach. Go to the next slide. So the way we initiated is to do a lot of mapping. There was a lot of merging going on and leveraging the information and resources available. It was taking a gestalt and bringing together individuals and organizations that were, sort of adding on the left hand and on the right hand and understanding what both those two were doing, and ultimately and definitively tracking the data. So before we moved on all of those, next slide. In Bexar County, the Mental Health Consortium, we created a consortium, and the consortium came together and said, well, what are the first couple of things that we have to do as a community? How do we address serving individuals that are suffering from mental illness and substance abuse, medical disorders that are devastating? And so the approach the consortium came up with was to look at it from a perspective of phases. So for mental illness, it's a chronic, long-term disease that has an initial phase, crisis phase, and then it has an interim phase where you're doing a little better, you're out of crisis, and then you're doing really well, you're into rehabilitative services, and you're moving on. Unfortunately, within the natural course of the illness, sometimes you're doing maybe well, and you go into crisis. And then from crisis, you go, you're doing okay, you get into an interim stage, but you still need some help. And so If you go on to the next slide, what we're really doing is focusing on the bullseye. And the bullseye, we've sort of labeled the traffic light. And the traffic light represents simply that when we're in crisis, it's a crisis. Everything stops. There you need the most help, the most assistance, the highest number of resources around you. You're not able to take care of yourself. So you need help. You need that medical assistance. You need that support system. If you're doing well, you're going to go into the yellow zone. And in the yellow zone, you maybe can stand up. You're doing okay. You're doing better. You've got some living skills going on. But then, you're progressing. You're learning and get into the green zone. Boy, now you're into recovery. Now you're into resiliency. And at any given time, you may go and have another crisis and go right back to red. So it's incumbent on the system of care and the organizations around us to be able to support the individual person at every single stage. And all of the other circles that you see support the target. And we want to be in the green zone for the longest amount of time, the highest level of wellness that we possibly can. So up on the left-hand corner, you see what we share with folks that are first encountering mental illness. We say, don't go it alone. Learn the system. It is a system. Know that it may take time. Call somebody. Engage in relationships. That's why NAMI is so critically important. So as we moved forward and we made the distinction of how we were going to sort of differentiate, and we were going to make sure that there were supports for all the different levels, next came the awareness that there is a very big, there's mental health needs, and then there's the criminal justice system. So what framework, how do we approach this to where we're addressing mental health issues, but within the criminal justice system? And at this point, I'm going to turn it over to my esteemed colleague to show you how we modeled a particular approach to address mental illness and substance abuse within the system. Mike?
Thank you, Gilbert. Mike Lozito here. Thank you, Greg and Commissioner, for providing information on what we're working on here today. Next slide on there. Just want to basically state that I'm not a mental health expert. I'm more of a systems expert, criminal justice. So it's been a real privilege working with Gilbert with his knowledge on the mental health system, and this has really helped me to understand more and forging together on this, because very few departments have a mental health. Well, actually, I think we're still the only department in the state or county that has a mental health department itself, so that they concentrate on expanding and provide getting more services out there in the community to help individuals out. And I also want to state with that green light, red light model, what we have to understand, at least with mental health, is that this is not like the broken arm and it gets mended and that's it. From then on, mental health is a lifelong issue to deal with, and that's why individuals always move into different areas. But I think our goal is that we wanted to make sure that we develop a system that doesn't put people into crisis, and that crisis is the only way that you can get help in the community. Our goal is with the mental health department is to be able to go upstream, be able to help individuals at the earliest stages to avoid individuals being in crisis mode. But our goal was to really look at the system. And when you start talking about criminal justice, it's very confusing. It's a large system, many pieces on there. And so one of the best things that I have worked with, and actually in working with other individuals that don't have a lot of knowledge about the criminal justice system is the sequential Intersect model that was developed by SAMHSA and Gaines group. This model really takes into effect all stages of the criminal justice system, and it really helps to point out like who's responsible in this stage, and then where can you identify what's needed. You know, what are you missing? And one of the things that Gilbert talked about that we wanted to look at were gaps in systems, right? So this is a good way through sequential Intersect to identify gaps within your criminal justice and mental health system in the community. And the goal is that, you know, trying to divert individuals and not be reliant on the criminal justice system. And as you've heard many times before, that the jail, usually in every county, this is no different, is usually the largest mental health facility in the county. And that's not good. Like here in jail right now, we have a little under 4,000 individuals. So you do the math on there, 20%, 25%. The 1 in 5 may have mental health issues, and you can see what that impact is. And the fewer services you have, the more you rely on your jail to be that group that addresses issues. So just basically on the Intersect model, the first one is the engagement with 911, with law enforcement, and the actions that law enforcement can take in diversion or doing something different other than arrest. Sequential Intersect 2 deals with the jail itself and identifying individuals in the system. What is it you can do for those individuals? Intersect 3 is the court system, and it identifies, we have, you know, specialty courts like a commissioner mentioned down there, that the specialty courts that we have, I think we have over 17 specialty courts now in Bexar County that address drugs, mental health issues, prostitution, DWIs, specific type offenses, and even in the civil courts with family courts, children's courts, you know, trying to address issues with treatment services and case management. And then you have an Intersect 4 where you're dealing with reentry, and that's when a person comes out of jail or comes out of prison. You know, what services are available to help them to be successful in their reintegration into society from that point. And then the community itself, which is either probation or parole. Next slide, please. So in this slide here, we're looking at the our system of sequential intercepts, and we built to show what is it we have here in Bexar County, because we use this as our guide to figure out where we are and what we can do better in those processes. And you'll see some examples there, like law enforcement assisted diversion, CIT program, you know, that they're CIT trained. We'll talk a little bit more about that. Our restoration center with our Center for Healthcare Services, our local mental health authority, being able to assist. Help from the state for Senate Bill 292, where we were fortunate enough to get a grant for a crisis stabilization unit to, besides having just 2 days on emergency detention, if a doctor feels an individual needs more help, then we can get them into a facility that will work with them up to 9 days additional, and really trying to help them get to the services and being able to navigate those services once they get released. So we'll talk more about that, but this is, to me, this is the critical intervention. What does a police officer have? What resources do you have? And what we tried to do with our system is it's usually jail or the emergency room when they run into a person with mental health issues. And what we wanted to do was reduce the reliance on jail and emergency rooms. So we have put together a system called our South Texas Crisis Collaboration that Gilbert will talk about here in a little bit. The other one is our judicial management, which is in the arrest itself. So that picture there, we built a brand new facility that houses about 512 additional beds for us in the jail. They're a little bit different because they actually have programming in the pods, so they don't have to go the middle of the jail or to other areas. These were designed to provide programming to inmates to help, with GED, whatever inmates needed as far as resources and for it to be there for them. But this is generally our arrest point, where if a police officer decides to arrest somebody, they're brought into the Justice Intake Facility. It's a large facility with open booking. And what we mean by open booking is there are not cells. It's like an airport, there are chairs there. If you behave, you can sit down. There are telephones there. They're free. They're no cost to use those telephones to contact family members, because our goal is to try and get as many individuals out of at the front end of the system versus them going into jail. So we have open booking there. We also have mental health clinicians 24/7. We have 2 that provide assessment services for individuals that are suicidal, or they may have had mental health issues. This allows also public defender. So we have public defenders there that will talk to them. And if they do have mental health issues, they can bring that to the judge to allow them to get released on what we call a mental health bond, or personal recognizance mental health bond if they qualify. And then once the judge approves that, there's already an assessment for treatment. The public defender has worked with the client or the individual, and then Center for Healthcare Services provides immediate services. So they actually pick them up from the jail and take them either back to their facilities if it's during their working hours, or they'll take them directly home, and they'll have a next day or next business day appointment with a counselor and a doctor. And then we work on trying to get medications. And then we have a pretrial officer that's also assigned, and they'll staff the case every other week, make sure the individuals are getting the services that they need. And we try to work on diversionary programming. Then in the courts itself, we have, I mentioned our mental health courts. We have veterans treatment courts. I know there was a question about having veteran services. So we have a felony veterans treatment court, and we have a misdemeanor veterans treatment court that work with individuals that had been in the military, and there may have been issues from when they were in the military that aren't getting resolved out here that might lead to criminal behavior, and trying to get treatment. And they're very connected with the VA with treatment services. As a matter of fact, the VA provides individuals for us to work with them to make sure that we get them into appropriate programs utilizing the Veterans Administration. And we also have reentry centers from where the only ones in the state, I believe, that have this. We have an actual facility where somebody it's only about a block from the jail. When they get out of jail, they can go there, get assistance for housing, employment, mental health services, medications, substance abuse treatment, AA groups, NA groups, our cognitive skills group. So Goodwill also houses with us there. So we try to get as many services around the person so they can get off to the right step when they get out of jail and have those services. And then we also have our collaborations with many other partners that we'll talk about on there. So next slide. So our judicial role, in front-end diversion, that's really where we're trying to beef up the system. Because one of the things is, if a person has a record, that record will follow that person generally their whole life unless they're able to get it expunged from them. And that also takes extra money. You have to hire an attorney to do that process. So if you don't have the availability of funds, it's hard to get something removed, even if it's one time in the system. So we're trying to develop systems where our district attorney has developed a cite and release program, working with law enforcement, where now they'll get a ticket for certain lower level type offenses, and the individual have a ticket, they'll report to our reentry center. There they'll see somebody from the DA's office and a public defender to help guide them through the system, and they'll work a plan up if they qualify. And then if they do A, B, C, and D, then no charges will be filed on the person. They will not show an arrest, and it will not show that charges were filed on that person. So they can, with a mistake that they may have made, move on. Also, if they're there and they need mental health services or substance abuse services, we're able to help them and get them plugged into the right program. So I think it's very important. And it's also, this is information for the judges, because when the judges see that a person may have violated the law, but they're trying to correct that behavior, this gives additional information to help the individual out if they end up in our court system. Next slide, please. So one of the biggest things is data. Making decisions, for us to be able to go to our decision makers like the commissioner and say, Commissioner, it would really help if we had this program, and we see that if we could do this, this could help us in diversions, it could help us with reducing jail population, or working with women for particular issues, or veterans. Data helps you in so many ways. And that's one of the things that with Bexar County, as you can see on this slide here, that we've worked with a number of programs with Meadows, Capital Health Planning, Council for State Governments. We're currently working with Harvard on a study. So there are a lot of organizations that have reached out to Bexar County, because I think we have been trying to work on issues, but really trying to look at us on collaboration all the way from the point of the elected leadership, decision-making, funding, and getting it right size for right size programming. And data really helps you do that. Next slide. So I think one of our biggest examples is our partnership with South Texas Regional Advisory Council, STRAC, where Gilbert will talk more about this, but this is the data that led us to this, that we actually did a study of everybody that within the safety net population. So that's individuals with either minimal insurance or no insurance at all in Bexar County. And out of that, I think we had 300,000 individuals in the safety net with either health or mental health encounters, over 1 million of those. And out of that, there was $1 cost attached to it of a billing, either to Medicare or somebody on there, about $1.1 billion. That's with the B. That's what it costs in Bexar County for our safety net population to get health. And then out of that, we were able to break down what was that cost for mental health. There were 33,000 individuals out of that 313,000 that had mental health billings or charges within there, about $200 million. Our homeless population was also in there. There was about $80 million of cost. And then our high utilizers, which was a very low population, I think on there, 3,507 individuals, $19 million. That's 1 year, and there were actual billing costs that were tied to these encounters. So data can wake you up and make sure that you understand that, hey, this is costing a lot of money, and we really need to figure out what's the right way, what's the right size in order to develop these programs. So I'll turn it over to Gilbert, and Gilbert, if you can talk about some of the programs we've implemented.
Next slide, please. So, and notice that Mike talked about, I mean, he showed you a lot of organizations, and they were all coming together, and that's a key piece. One of the most exciting things, certainly, that I've ever come across is the initiative that we now have with STRAC. And STRAC is the emergency services system for this region. They handle the ambulances and fire and EMS and all this stuff. And they're really, they coordinate with the hospitals and so forth. I'm going to be talking now about specific services that are provided by our organizations and how we bring them together. STRAC has been incredible, and it's literally leading us now in very many key ways. But before I go into this, I'd like to point out, you know, in the past, when we basically had a crisis in a 911 call, you had three approaches. 911 call came in, you either got the police, or you got an ambulance, or you got a fire truck, or an ambulance and an EMS, those three. So police, fire, EMS. And that was it. If it was a mental health crisis, you got one of the three. That was it. What STRAC is helping us to do is introduce a fourth approach. And that is, you know, it's not a law enforcement issue, it's not a fire issue, it's not a paramedic issue, but it could be a mental health issue. And so in doing so, STRAC is helping us, is leading us towards coordinating emergency detentions, what we call emergency detentions for behavioral health, for mental health. All of that is being tracked. This is what MedCom law enforcement navigation is. It's really about developing an awareness of where the 911 calls are coming from for behavioral health and coordinating those. You can see some of the facts there for, I believe this is 2019, 12,000 cases navigated January to August in 2020. 64% went to the hospital, 0 went to jail. This is only the beginning of addressing the inappropriate incarceration of the mentally ill that has gone on for decades. And then we have other specialty programs, the program for intensive care coordination. 2 points that I'd like to make here. Number one, we have individuals that need a tremendous amount of care. And, you know, when things go wrong and they go in crisis and you treat that, you're going to need to keep coming back, and there's going to be need for continual support. So intensive care coordination is absolutely necessary. When you have a crisis, you must provide treatment. When you provide treatment, you must ensure that there is continuity of care. So that's number one, that we're addressing folks that are really have high needs. But number two is that it's essentially allowing us to say, look, this is not I guess you could say a consumer or a high utilizer or a frequent flyer. Now we're calling them VIPs. These are very important people. They need help. Let's give them that help. So STRAC is providing this and many more programs that won't have time to go into right now, but let's go on to the next slide and talk about our incredible partners at the Center for Healthcare Services. Now, the county has done a couple of wonderful things in that we've provided funding for specific services provided by the center, and those services include, you know, case management for folks involved in the legal system, assistant outpatient treatment and support for that, a community reintegration program. So that's the program that Mike kind of alluded to. If you get arrested in Bexar County, you're going to get screened for behavioral health issues, for mental illness. If it's a nonviolent offense and something that the judge can, the prosecutor who is there and a public defender who is there can get together with a clinician that can say, yes, this person does have a mental illness, and Your Honor, it's in the best interest of this individual and the community to provide services. That individual is literally provided services right then and there. And then we have staffing levels for clinicians. These are licensed mental health professionals that are making all of these assessments. And then we have substance abuse services that are provided. Again, all of this single in one location in GIA, and then substance abuse services are provided additionally. And we also have services for children. Next slide. We know about the wonderful work that Haven for Hope has done. And this is sort of to give you an idea of the partnerships that are involved in serving this incredible entity. I had the privilege of speaking with of Kenny Wilson this morning. They are doing an incredible job, not just with COVID, but you're looking at a population of anywhere from, on the low end, 900 to 1,200 individuals. And they're providing homeless services, and we have bridging services for mental health, services that work from the jail out there. So all of these, again, are coming together to allow the best possible opportunity for our folks. Next slide, please. I'm going to turn it over to Mike to talk about our funding. So we've kind of talked about implementation, and now where does the money come from? Mike?
So some of the blend that we have there, and kind of on that Haven for Hope map that you saw there, the reentry center is right down the road. The jail is right within a block of the services there. So in our, we try, reentry services is also about a block away from there also. So we try to keep a lot of the services in one area to help the person, so they're not having to go all over town to try and get services. It's more like one stop. Our grants and so forth, we've been very fortunate because we are able to get grants from SAMHSA, the Substance Abuse Administration, federal grants, Bureau of Justice Assistance, various grants that have come in. The Texas Veterans Commission have provided us with grants, and we're able to fund our specialty courts. Also, the governor's office provides a number of grants too for us to help do that. We have dollars into our magistration system, so that justice intake facility that you saw, the building there, it's 24/7. So there are judges there, magistrates there 24/7. We have the DA's office there 24/7, the public defender's office, pretrial services there, the mental health clinician, University Health Systems is also there 24/7. So if that's one place where you can get all services, or at least try to get that person into the right fit as they're arrested, because that's the time, not when they get convicted, maybe a year later or whatever happens, or a case gets dismissed. People need help right now because that's why they're in contact with law enforcement. So it's best that you address the issue. I know there was a question on domestic violence, so we've started a domestic violence court to try and get services to help individuals so they don't push the anger, and figuring out ways to deal with traumas, and increased victim services for individuals on there. So a lot of money is being spent in that area now, especially with COVID. There's, you kind of see an uptick in family violence type offenses because individuals are at home, and the outlets for relief for individuals, they don't have them. And so just trying to get services for individuals is important. For reentry services now, we're funding for residential facilities, inpatient services, which we haven't had that. We've had some small grants, but when you go in there and you see the studies say 60% of the individuals have history of substance abuse that are going into jail, and you don't have money for treatment, for inpatient treatment, that doesn't work. So we started doing that, and that this gives us what we call extra capacity in there. Next slide. So this, Commissioner helped us, and I'll go over it very quickly, but our Bexar County hospital system gave us the opportunity they funded $7.1 million for mental health, and specifically because they want to help address issues in the community for mental health. So money went to homeless services, to crisis services, We increased our capacity for the, Gilbert talked about South Texas Crisis Collaboration. So that's where a police officer, rather than taking them to an emergency room or a jail, they can take them straight to a psychiatric unit. Well, now we also have that for children on there. So if there's an issue with that, they can take them there, and there are services available to help them and connect. So we also have added dollars that were addressed for victims of domestic violence, the battered women's shelter, some additional dollars. And then the one that we're most proud of on a study is the pre-crisis services. So we're, rather than spending everything in crisis, we're trying to work that end of it, but we wanted to start putting some dollars out in pre-crisis. So if somebody they don't have the money, mom's son, and they're having problems, we want to be able to, they have a resource that they could go to and get a doctor's appointment within a reasonable time and get help for that person so they don't go into crisis, right? So this is our one. It hasn't kicked off yet. They just hired the psychiatrist to run the facility, and they will be probably in operation probably early 2021 in full scale. So we'll have more information on that, but we're really proud of that. We really want to see that expand. And then we also did for Center for Healthcare Services is going to expand their clinical services for mental health on the east side. So they have a nice facility that they've moved into, and they'll have doctors there. So they'll have either medical attention plus mental health services for individuals to do on there. So next slide. So other funders, Philanthropy, Methodist Healthcare Ministries, you need a partner. It's not only government, state, grants, that you have to have that private partner out there that can help you do the studies that are necessary. So they paid for these studies with that big one that you saw for the 1.1 billion capital healthcare planning, the Meadows mental health assessment, which kicked off like, yeah, you can do a better job in your connection. Sometimes we have silos of success, but they don't share information. So what we want to do is be able to share information, make sure we're doing the appropriate referrals and people getting the help when they need help, when they're in crisis or when they're not in crisis. And the last two slides here, one on here, next slide, is some of the things that we're doing, a trauma-informed care community. So we're trying to certify a number of organizations, even our law enforcement and our criminal justice system are participating everywhere, schools. We're trying to get as many individuals into the trauma-informed care model and make sure that we understand individuals, because sometimes we're supplying the triggers that are out there for individuals, and we want to make sure that we're doing the right thing when we're providing services for individuals. And the other one was Pathways to Hope, which is a yearly conference that we have that NAMI helps us with. Doug Beach holds that, and we had over 2,300 individuals participate nationally back in August. But it's a way that we're trying to connect churches with mental health and trying to get more information out there, more awareness on mental health and what can be done. Last slide. This is our, somebody said, I don't really understand the mental health system. I need a map like Disneyland, what's out there. So if you've ever been to Disneyland or Fiesta, Texas, or any of those places, you see the maps. Well, this was a map that we were putting together. This is not a final of it, but our behavioral health system, and you can see crisis is number one on that end of it. My goal is 5-6 years from now, crisis is at the end of it, and the other parts of the system are at the front end of it as you move along to get help. But these are all the components of a very complicated system on there. I know we've talked a lot and we haven't allowed a lot of time for questions on there, but I don't know, Greg, do you see questions? I see a bunch of them popping up on here.
Yeah, we're going to go through this Q&A box here where people have been submitting questions, and I think you all will be able to see the questions in the Q&A box yourself, but I'm going to read off a few of them and would love to hear your thoughts. So there was a question in the Q&A box about the George Floyd protests and the calls for defunding the police. Have you seen this movement sort of result in any shift in priority in Bexar County towards more focus on behavioral health and criminal justice programs rather than to the police department directly? Have you seen any impact of the George Floyd protest movement on priorities in Bexar County?
I believe on that end of it, it's given more awareness to a lot of elected leadership on focus, and I think in Bexar County, we've been trying to shift for years on what we call criminal justice reforms and justice initiatives. So we've been kind of working to try and shift those dollars, but not to defund. I think it's my approach would be on it is more balanced funding on there, because you still need law enforcement for public safety end of it, but I call it, my analysis of it is called freeways with no exits. When somebody when you build a freeway, you determine off ramps, on ramps, rest stops, mile markers, how much concrete, all those things are pre-planned to the inch all the way through. And when we deal with the criminal justice system, we may just deal with one part of it, maybe hiring more police officers on that end, but we don't balance it to say, okay, police officers are going to encounter more people with substance abuse issues or mental health issues. How much did you add in funding for that? So that freeway with no exits is, we need to put the exits and we need to plan. And I think that's given more balanced funding to the system is the way I look at it and how we approach it.
Yeah, thank you. And there is clearly an emphasis here on building a system of care that provides interventions across the continuum of need. And you use the sequential intercept model as sort of framework for where to insert these interventions. There's a questioner sort of asking about, how do we move things even further upstream? How do we prevent people from system involvement in the first place, even before Intercept Zero? And they suggest, one opportunity for that is the primary care system. Gilbert, what are your thoughts on that particular option of like building up the primary care system, and what other things can be done for prevention?
That is such a great question. That is an incredible question, and it is it's perfect, and that is because you have a health system, and now you've got a mental health system, and they're learning about each other, and they're becoming one. But we are also evolving to the place that we are understanding that there is a condition, that there's this illness, and this illness will cycle into a crisis, and then there'll be periods of stability, and then crisis again. So ultimately, it is truly about the gestalt, about long-term continuity of care. And if anything that we're learning, or we have learned here, is if you take care of one crisis one day and you take care of it the next week and maybe the next week, unless you allow for accountable continuity of care, so treatment that is always available for the need at that time, until that person has a longer history of adaptive learning. So continuity of care, if I could stand on top of the mountaintop and yell 3 words, it would be continuity of care. Great question, thank you.
Absolutely. And one questioner is asking about the Intercept where law enforcement does come into play, where law enforcement does get involved. And they're wondering if you can talk about what mental health training and what mental health care does law enforcement in Bexar County receive? So on one hand, you have the training that is provided to law enforcement officers, and they're asking about that. And on the other hand, they're saying, how do we take care of our first responders? How do we take care of their mental health? Because they may be exposed to secondary trauma because of the population that they're there, you know, to provide crisis intervention services to. And I do see, Gilbert, you have the Ernie and Joe poster behind you. So can anyone speak to, you know, mental health training programs for law enforcement and also mental health care programs?
I'll take a shot at it and then Mike can come in. So essentially, the effort, at least in Bexar County, has been to really take crisis intervention training to a whole new level. And we've done quite a bit of work. But I do want to say that training must be ongoing and it must be broadened to the highest level possible. So to answer the question specifically, yes, officers for the sheriff and SAPD, they do go through 40 hours of crisis intervention training, which consists of information, skills training, and referral, learning about referrals within the community. So most law enforcement officers have that training, but it's important to continue that training, to provide that training and ensure that officers understand that they have that support. And this system of care is that to ensure that the easy button no longer is jail. The easy button is access to treatment. Our restoration center, clearly leader. Officers have the discretion, if it's a nonviolent offense, to take the individual to the restoration center as opposed to automatic jail. So training is absolutely key, and we must continue that. And also ensuring that our standards are maintained and kept in terms of talking about risk management and talk down techniques and so forth. Now, that brings up another point, and that's key for our first responders, and that is trauma-informed care for themselves, because our officers and now with COVID, even our paramedics and our nurses and so forth, they are facing trauma every day. And for that fact, all of us, if you're breathing and alive, you're dealing with trauma, and it's called COVID-19. It has impacted all of us. So the awareness that our officers and our first responders need to make sure that we provide systems of support for them is critically important. And we need to learn about the effects of trauma that it has. There are physical effects. Trauma keeps you from learning things. It limits your ability to have adaptive functioning. And I could go on and on and on. But we've got to ensure that we take care of our first responders. We must ensure that we continue educating or providing opportunities for education to our law enforcement officers.
Absolutely. That's so important. So there's a questioner asking about, a questioner who has identified a gap area, which is local psychiatric services for juvenile offenders on traditional Medicaid. Where is assistance available for that population?
And then that's, identifying that assistance for the population is difficult, and it is there. It's just you're going to have to do a little more. We're going to have to do a little more research. There are alternative avenues to getting that assistance. What we want to do is make sure that young child never gets into the juvenile justice system. So we want to divert there. Certainly, the Center for Healthcare Services is leading in crisis services for adolescents, for children and adolescents. We have our stakeholders, Clarity Child Guidance Center is available for there. And generally speaking, as I mentioned before, those three approaches that we recommend to people, first of all, reach out to someone. That means pick up the phone. That means get on your smartphone or dumb phone for that matter, go on the web. If you'll go on to bearcounty.org and look for mental health resources, you'll see that we have a plethora of resources there. If you make enough phone calls, you will get somebody that will be able to provide you help. There are shortages. I'm not going to, sugarcoat that. We do not have enough psychiatrists. We certainly don't have enough child psychiatrists. And so these are great needs. Even this map here, it will show us where things are, but it also in the process will show us how much more work we have to do yet.
Regarding the STRAC, are there volunteer opportunities with the STRAC, or how does someone get involved with the STRAC? And is there anything that you can share about the new, what is referred to as the CAHOOTS program?
Sure. So with STRAC, STRAC basically contracts with partner organizations like Center for Healthcare Services. And so if somebody's looking to volunteer or try to become a peer support specialist in that area, they should contact them to find out what the requirements are to get those types of certifications on there. The CAHOOTS program is what we call here, what is called SMART program. And I'll get this wrong, Specialized Multidisciplinary Alternative Response Team is what we call it. So it's the SMART team. And basically it's where on mental health calls, this is primarily for unincorporated Bexar County. So that's out like past the San Antonio city limits in that area, where a mental health person will respond to a non-threatening mental health call on there. So that and a paramedic will go out. And the thought behind that is like the STAR program in Denver and the CAHOOTS in Eugene, Oregon, the way that those programs are designed, you have the paramedic that goes out with that mental health person. And I think one of the things that we're all familiar with is when we go to the doctor's office, they're going to weigh you, they're going to take your blood pressure, they're going to take your temperature. We all know that, right? When you go to a doctor and you see them. So that kind of sets the tone with that person to relax that individual, to know that, and then that allows that mental health specialist to talk to the person and find out what the issues are. So if it's a medical, then we can address medical, medication response or something on that end of it with the paramedic. But the mental health clinician can also work with the person. And then the other thing on there, talking about peer support, part of that contract with STRAC with the county on there is that Center for Healthcare Services will provide peer support specialists, and they will actually work with the person. So it may be something where it doesn't initiate somebody coming out, but a peer support person would call them and say, hey, do you need help? Do you need help going to see the doctor? We're willing to go with you. Provide that special support to help that individual, because we want to, our thing is more holistic on it. It's not just that time and then we're done and then for the next time. What we're trying to look at here is, where do we get that person? Do we get them into services? And what do those services look like? So the police officer is not having to engage those services on a repeated times. So we get the person into case management, and one of the programs, the PIC program, I think that Gilbert alluded to, provides that. They have a doctor, they have case management, they have medication management, they have all the things that are involved to help a person succeed so they're not coming back into the crisis system. And we're keeping that, remember the stoplight, the green light, yellow, red for that individual, and trying to keep people green, yellow, green, yellow, green, yellow, and not into that red area.
One questioner is asking about discharge planning. How can we improve discharge planning from the psychiatric system? And how could discharge planning perhaps better work together with the court system and with DBH? Any thoughts on that?
address how do we, in order to do that, that's so critical, that discharge planning. And the key is that often when someone is discharged, they have a very nice plan. And it says, you're going to go meet your provider in 2 weeks. You're going to have that appointment. And so-and-so is going to work with you. And this is what you're going to do. And then life happens. And when life happens, you can't catch the bus, or you can't make this, or your child gets sick, or you get sick. And so this incredibly well thought out treatment plan is dissolved. So we have to know that we've got to allow for accountability in on behalf of somebody other than the person going through the mental illness. So what I'm saying is good case management, that a case manager can call and say, hey, wait a minute, you were supposed to be, we missed you at your appointment, what happened? And so as we provide that individual with support services and reminders and help them navigate the probability of resiliency, recovery increases exponentially.
Also, on there is with that South Texas Crisis Collaboration, part of the system that we're paying for is this system called Signify. And in there, it integrates systems of all the partners. So whatever happened in case notes or discharge from a hospital or to the next person, all that data is being kept. And so for the next person, so whether it's Center for Healthcare Services or a private treatment provider, that information is in the system, and we know what that continuity is on there. And then the other thing, like I said, was data. So now we're tracking what happens, how many times does that happen? Are they able to stabilize, or does that pop up on the screen, like on your dashboard of your car when the water temperature runs hot, knowing that, hey, this is not happening. They may have missed their pickup of their medications or these types of things, and we may need to send a case manager out to find out what's going on. But I think Gilbert hit it right on the head, is that case management piece. And we're trying to put that in there as much as possible. Just like our treatment courts, we have a case manager and we have a probation officer or a pretrial officer, but there's a case manager that makes sure that there is continuity all the way around, legally and medically for that individual. So we're putting that in place as many times. And then the other thing is capturing the data, which is very important. So we have the system working toward that. Matter of fact, we just had a meeting this morning. I noticed one of the questions was having the primary physician involved with what's going on with the particular person. And we're looking at, making sure we're capturing that data in our system to make sure that those informations are passed on.
One questioner is asking, what are the implications of people without access to affordable health care? How is that being addressed in Bexar County? Is that something you can speak to? And I think what they're getting at are people who are uninsured, who don't have good access to services because of the fact that they lack insurance. How are their needs met?
I think on that end of it, I'll just comment a little bit and let Gilbert on there, but Dr. Bridger, when she was on the health department, had put out a map here in San Antonio, and it basically showed if you go down Highway 90, Interstate 10, if you lived on this side of the freeway, or if you lived on this side of the freeway, you're most likely, you could live 20 years longer if you lived on this side of the road. And basically it was about economics. And when you on there, and could people afford insurance? Did they have the jobs that provided the insurance? And what they found was in that study is that those individuals that had access to health care, not just during emergency situations, but were able to see a doctor, have physicals and those types of things, live longer on there. So yeah, it makes a big difference to be able to have access. Gilbert?
Let me just point out something that when Mike was going through that one slide with the university healthcare system, there was a second bullet to the very end that I know we've thrown a lot of information at you, but it was talking about the rapid access clinic. That clinic is specifically for folks that have no insurance, they have no resources, they have no support, they're not in crisis yet, but they're getting there. Heretofore, there was not a place for persons to go. You know, if you've got, even if you have insurance, sometimes it's difficult. But if you don't have insurance, we have to provide that vehicle for the public. And just one example is our implementation of the rapid access care clinic.
There are a couple people asking about housing options. What role do housing options play in the continuum of care? Can you give more detail about the various housing options available? And would you say that there is a true continuum in housing, or are there gaps?
There are gaps, you know, all the way around in our system. That's one of the biggest needs that we have is you know, we don't have enough programs or enough what we call, I think I worked on a panel with the city when they were looking at housing in Bexar County and city of San Antonio, and we called it what we called enriched housing services, and there was definitely a lack of services for those populations that just need a little more help to keep stabilized, to live where they're at. And to answer that question, we don't have enough. We're way below what is needed out there in the community.
And there's a need for transitional level of housing. So housing according to where you are in terms of your recovery. You know, when we get sick and we're really sick, we have to be in a hospital. And sometimes we have to go to rehab. And then sometimes we go to a semi-independent. So there's certain level of a good example of where we ultimately can benefit from being is the Fairweather Lodge system. And that's ultimately for folks that have mental illness that are now on that green zone, and they're able to take care of themselves, and they're able to enjoy independent living in a group home of less than 5 people, and then from there we can go on. So housing is absolutely critical, and Mike is absolutely right. We do not have enough.
We started, Cross Points opened up a facility for behavioral health. So there are like 35 beds that are there. And then I think they've added like 10 women's beds in other facilities to help address the need in the community. But there's a lot more need out there.
Have any partnerships been explored with the higher education system in Bexar County, including but not limited to teaching future mental health professionals about the criminal legal system, teaching lawyers and judges about the criminal legal system and about the mental and behavioral health systems? What are your thoughts on opportunities like those?
We are always taking advantage of them. As a matter of fact, you know, Mike talked earlier about the Capital Health Care Project. Before that, Trinity University came in and did a study and helped us identify and looked at gaps. We've spoken multiple times with the University of Texas Medical School. We're engaged with our opioid task force with the universities. So there's a constant need for including those higher education systems and participating and benefiting from their resources.
And we're running a little low on time. We might have time for 1 or 2 more questions. Can you speak at all to how is Bexar County utilizing psychiatric advance directives, if at all? And how is Bexar County utilizing navigators or case managers for people who come into contact with crisis services? So that's a really kind of a two-part question. Anything to say on psychiatric advance directives or navigators or case managers for people who enter the crisis system?
There is not enough that has been done on psychiatric advance directives. They're a great idea, and it's certainly important. But the reality is that if many of us don't have the resources to get to a place where a psychiatric advance directive can even be recommended. So when we get there, that's sort of a step ahead. We don't have any formal work done on that particular area that I'm aware of. And what was the second part again?
Sort of asking about how we can better utilize navigators and or case managers assigned to people who enter the crisis system on first contact with the crisis system. And those navigators or case managers could stay with the person until the person gets a warm handoff to integrated services. Is that something that's already being done, or do you see any, if not, do you see any potential?
In a way it is. And, again, Mike mentioned peer support services. A peer is an individual who has learned experience. They've been there. They've done that. They got the T-shirt. They know what to expect. And can you imagine whenever you've had a worry or a particular trouble and a friend comes to you and sort of gives you an advice and said, hey, why don't you go here? Absolutely critical, and they're so important. A navigator shows you the light where there is darkness, and it is so key to support that kind of services. So there's been several levels of navigators across our organization. Most of our providers have options for navigators. And I know we've hired, and Mike's hired several here at the county that are just, they are so incredibly important. Again, light where there is darkness.
And so someone put a good suggestion in about psychiatric advance directives, how Rio Grande Legal Aid can help with psychiatric advance directives. And they have that organization, Rio Grande Legal Aid, has an office on the Haven for Hope campus. And if I remember correctly, I think that Rio Grande Legal Aid may also have collaborated or be collaborating with the San Antonio Clubhouse. And is there any perspective to share on where the Clubhouse in San Antonio fits into the continuum of care or into the sequential Intersect model in any way?
Absolutely. The Clubhouse actually falls into the yellow and green zones. So the yellow, when a person is doing pretty good and they just need some support and some help, and certainly in the green zones, they're ready to do supportive employment, they're ready to do job skills. The Clubhouse provides what we all need: social interaction, social belonging. We all want to be a part of the tribe. And it is such an important and supportive environment there. Everyone just kind of pitches in and you do what you can do. And there's a sort of a family that's geared towards success. So Clubhouse model, I mean, I can't say enough about how wonderful they are.
And I also think on the, as far as sequential Intersect model, I think in almost every section, they can fit in there to help somebody guidance through either at the beginning of the system or in the reentry portion of it. Just think that the services they provide are helpful for individuals that have the mental health issues.
Thank you all so much. And I think that's all we have time for on this webinar. So we're going to go ahead and wrap up, but I want to give a special thanks to Gilbert, to Mike, and to Commissioner Rodriguez for their insights. I think this has been a tremendously powerful presentation. I'm amazed by the level of engagement and the level of attendance that we received on this webinar. Well over 100 people in attendance, many from Bexar County, many from outside of Bexar County. I learned a lot. I suspect other people did. And I really appreciate that. Or I would really appreciate if people, after the webinar ends, if you can fill out the evaluation form that will show up on your screen. We'd love to get your feedback so that we can use that to plan our future events. And speaking of which, the next one is on Wednesday of next week. Please visit namitexas.org/webinars. There are no costs to participate in our webinars. We appreciate any support you can give to NAMI Texas in helping us continue to make no-cost options, educational and training options like this available to the state of Texas. Thank you all so much for your participation. Thank you especially to our panelists, and we look forward to further engagement with you down the road. Have a great day. Thank you all so much.
Take care.
Bye.
Bye-bye.